Good evening again, ladies and gentlemen. My name is Adrian Dyer-Patorsky, and I am here again with another discussion board for my PhD class. So let's jump into today's presentation. So today's discussion will be on experimental therapy, discussion 2. And the course is applied counseling theories. And of course, yours truly, the presenter, Adrian Dyer-Patorsky. And I attend Liberty University online, and my wonderful professor, Dr. William Townsend. And May 26th is the due date for this discussion board. Let's go into this week's agenda. The agenda is to discuss how experimental therapy session was similar or different to experiential experimental therapies such as Gestalt, Rogerian, and emotional focus. So these were videos that were already given by the professor for us as students to watch, and then we can make our commentaries from these videos. Secondly, explain any Christian worldview thoughts that came up through watching those videos for this week. And of course, we end with a lingering question for other classmates to respond to, as directed by the professor. Now I will go into a small interlude where I will play a song that really touches my heart, and it really speaks to the different theories that I will be speaking about and my interpretation, or what I want to discuss about what I've read and watched so far for this week. So I hope you guys are blessed with this music. Okay, guys, I cannot play the entire song, but I'm really touched by that song, and I think it was not required by any chance, but I just felt driven to put that as my introduction as I go into my presentation. So I just want to give you a brief background information as it relates to experimental therapies. So back in the 60s, we have experimental therapies were conceived, or experimental therapy were basically conceived in the 1960s out of the school of humanistic traditions, which was opposed to the analytic and behavioral perspective, such as Gestalt and other experimental therapies. As the name suggests, experience is the foundation of change and the bedrock construct of our personality. Famous examples of experimental therapies include process experimental therapy by Leslie Greenberg, now under more straightforward label as emotional focus therapy, or the abbreviation EFT. Focus methods, we have experimental therapy by Halvin Masher, and we have symbolic experimental therapy by Carl, and then we have Gestalt experimental therapies. Now on the other hand, experimental family therapy is adapted to improve and enhance the emotional intelligence of an individual or couple to correctly interpret their emotional state while helping them to comprehend and effectively regulate their feelings. Gestalt and experimental therapy and that do that. The clinician can then draw on evidence-based strategies to boost adaptive emotional awareness, affect control, and empathy, coupled with a better self-awareness of practical communication skills. And this credit goes to Gestalt and experimental therapies. However, maladaptive reactions are reconstructed by the therapist and replaced with a more adaptive self response and to other awarenesses. And then again, credit goes to Gestalt and experimental therapies. Finally, as per the video sessions, the clinicians serve as an emotional coach to the clients to be more aware and in control of their feelings and themselves and towards others while validating others. And again, credit goes to Gestalt and experimental therapies. There are 5 examples of experimental therapy effectiveness by Saxton et al. 2022. And I pulled these together with, of course, empirical research. But from the videos that I have watched, I have realized that evidenced by the video session, the clinician examined guilt while using experimental therapy. It improves the client competence to forgive themselves and offer themselves more compassion. And this is something, my friends, that we cut ourselves short of, because oftentimes we don't have compassion on ourselves. We don't celebrate ourselves. We don't celebrate our small victories or small wins. We're thinking about the big picture, and this is what creates distorted thoughts in our mind. This is a core or a contributing factor to our stressors, because we just don't give ourselves a break. We need to be more compassionate towards ourselves as human beings. 2, the sessions look at the role of experimental therapy for relationship issues, reveal that this approach assists individuals, couples, and families with more constructive outcomes as they deal with challenges not limited to trauma and infidelity. 3. The clinician helps individual clients and couples with attachment defiances or issues, challenges. I don't like to say issues, I like to say challenges because we can overcome them with the help of God. And experimental therapy aids clients to have more awareness of their experience and emotions, resulting in their overall satisfaction. 4. Experimental therapy is also helpful for treating eating disorders, as one played out in one of the videos that we watched. So it helps when treating eating disorders, and where the clinician can combine it with cognitive behavioral therapy, changing the mindset, changing the distorted thinking, the distorted thoughts, and replace those with more healthy thoughts, healthy thinking, changing how the mind thinks. And 99% of our distorted or mental health issues are based on how we think. So if we change our health, our mind and how we think, instead of thinking negatively and replace that with more positive thinking, you will see the best result, and you will thank me later. Just try it. So CBT is a tool, or a part, it's a therapy rather, where clinicians use, like ABA therapists, social workers, psychotherapists, they use CBT to reshape, or reconstruct, retaught, reteach the mind in the right way. 5. Post-traumatic stress disorder, psychodrama, trauma-focused experimental therapies have shown to decrease PTSD symptomologies by over 25% in the initial 2 to 3 week period. And this is Saxton et al. 2022. Now, as it speaks about your Christian worldview, I would like to quote, in conjunction to what I've just stated, the facts, is 1 Thessalonians 5 verses 11 from the King James Version, and it reads, "Therefore, comfort yourself together and edify one another, even as also he do. Therefore, exhort one another and build each other up, even as also he do. Therefore, encourage and comfort one another and build up one another, just as you are doing." Now, as clinicians, we are not here to edify ourselves only, but to help others as we pass through this life, so that our existence won't be in vain. And I would like to close this out with Proverbs 27 verses 1 to 17, quoting from the King James Version. "Boast not thyself of tomorrow, for thou knowest not what a day may bring forth. Let another man praise thee, and not thine own mouth, a stranger, and not thine own lips." King James Version again. Iron sharpens iron. So as we pursue higher education, as we obtain or attain deeper knowledge and understanding, let's use this to help others to restore their mental health, provide and guide through spiritual interventions. Let's intercede and seek spiritual clarity. Let's be transparent in our daily transactions. Let's be accountable as clinicians for our actions. Because as leaders, as world changers, we must be transparent. We must be a model of what we're preaching, and we must be held accountable. And of such, we have the APA guidelines that governs our profession, and of such, we should walk toe to toe in that and supplement that also with the word, the Bible, of course, because it is the word that teaches all man. Let's wear the word in our heart. That is our church. So before I begin preaching, which is not a requirement of the lesson, now my lingering question is, when is it right to push a client? And to what extent, as clinicians, do we do this? And I repeat, when it is the right time to push a client, and to what extent, as clinicians, we can push these clients. So, ladies and gentlemen, I really just appreciate you listening to me, and I just want to put in a little summary before I go. So last but not least, so the major difference that I detected from the experimental therapies such as Gestalt and Rogerian and EF, emotional focus therapy, is that they're all person-centered. They're all client-centered. Let's look at Rogerian. He talked about congruence. He spoke also about the unconditional positive regard. Being present, the clinician being present, being authentic, being organic, being true to his or her client. Showing that genuine love and care. Empathy is not sympathy. We're not feeling sorry for, we're empathizing, we're putting ourselves in the client's shoe without losing our own self. And that is what empathy is. I can see, I can imagine I can put myself into that situation and see how it would have impacted my life if it was me in that situation. Because clients don't need textbook therapy. They need someone who is real, someone who can, be there for them, understand where they're coming from, non-judgmental. And these are elements that create a good therapeutic alliance. Providing self-disclosure, and let it known, self-disclosure, clinician providing self-disclosure, it should be said or disclosed with caution. In that, you should only say something or disclose something that will be beneficial to the client, to their situation. If it doesn't have anything to do with the client, it doesn't worth saying to the client, because it's just not. We don't want to cause harm to the client. The session is not about us. The session is about the client. But sometimes the client may bring up a topic, and then we can self-disclose an experience that will make a point clearer to the client. So that is what I was talking about when I say self-disclosure. Now, when we look on Gestalt, Gestalt means the whole, the entire being, not a percentage, not a fraction, but the entire human being, the entire person. The client, the therapist in this session was more directed. He was like the driver in the session, asking the question, poking the bear, asking this, asking that. He going to the past, but he didn't dwell there. We pull out some things from the past and we bring it over into the here and now, and see if we can marry those and deal with what is presently happening and how we can resolve this situation here and now. Guys, we cannot do anything about the past, but we can do with what is in front of us today. Tomorrow is not promised. So let's work on what we can do today so we can probably change tomorrow. Okay? Now, it uses a technique called the empty chair. And the empty chair technique is like psychodrama. So it falls under the category of psychodrama. So the client will place, say, for example, the mother into a chair, and then the client have a problem with the mother, so they place the mother in the chair, invisible mom, and then you will verbalize what, say we are talking about forgiveness or a childhood trauma, you want to learn to forgive your mom. So now you will role play how you feel using your iMessages and all the other techniques that the clinician will be there in another chair guiding you to practice. Then you will do role reversal. You will be the mom, and then the empty chair will be you. So you will communicate as your mom to the empty chair, which is you, if you get what I'm saying, your feelings. So that is how the empty chair technique works. It brings clarity, it brings new awareness, and yes. So let's focus on one more. You have the EFT. It is more of a collaborative effort, meaning the client and the clinician, they both have something to put or to bring to the table. So both work in an alliance as allies together to make the best of what the session are to achieve the goals of the counseling relationship. So they become, the clinician help the client to become more aware of their emotions. They are more explorative, so they explore different things, they practice different things, and through exploration they can draw on dreams, they can go on the things that happen in childhood, the family history, and describe those experiences in details, and then the clinician can find um, little cracks into those statements or those descriptions, and then bring them forth into the session, and then we get the client and the coach, the clinician, can have a discussion and then see how we can resolve these unresolved issues. Okay, so again, my lingering question is, how do you know as a young counselor when to push a client, and to what extent do we push those clients? So guys, I want to thank you so much for listening to my presentation. I hope I make sense. I am still learning, so please don't judge me too much. But I hope this week discussion, you learned something. If it's even one thing you take away from this, but I would really appreciate it. So I will close out again with a little bit more of this, and then see you next time.